So my mom is a doctor. My mom is an anesthesiologist, and so I always had a female role model growing up, of a physician, in my house who was a woman. Although she was great because she didn't pressure me into wanting to do medicine. She was just like, hey, and I did like science and I liked people and whatever, but she's like, I think your personality would be a great fit, but it wasn't like I had to go into this field or something like that. Um, so anyway, so that was sort of like my just exposure in the first place, and then how I my particular specialty. So endocrinologists, usually we are the ones who specialize in hormone disorders. So for example, diabetes is obviously the most commonly known, hormonal disorder. Thyroid disease, your thyroid is a gland that sits in your neck and runs all these various, things in your body. Um, my subspecialty, though, which is obesity medicine, is pretty rare, to be honest. It's up and coming, I guess you could say, in the sense that it's becoming more and more common. But how I fell into that was really interesting. So many years ago, when I did my fellowship training in endocrinology, right, which is the 2 years where you specialize into endocrine, I happened to, it was just dumb luck again. I happened to do a rotation. Like I spent 3 weeks with this forefront in my field, like this guy who was like kind of at the cutting edge of realizing, frankly, now, over 20 years ago, that we needed a field of medicine to focus just on obesity in itself. And so I did a rotation. Again, I spent a couple of weeks with him in his clinic in New York, and and that's the first time it just had crossed my mind at all. I was like, oh, this could be a field, into itself. And then when I went into just general practice of endocrine eventually, I realized that nobody was helping my patients with their weight in a concrete way. Like, I'd talk to my diabetics whenever I'd say, hey, has anybody ever talked to you about, treating obesity or, my patients with obesity, like, and they'd be like, yeah, well, my doctor just tells me to lose weight, but they don't help me. And so I realized that there was a real need for this. And I've always, frankly, I love food. I love talking to people. I love helping, people in general. And this is a field where, frankly, my patient population, which are people who have overweight or obesity, are really discriminated against. It's really terrible. Like they're treated terribly. They get poorer medical care because all people see when they walk in the room is somebody with a weight problem, right? They don't see somebody as somebody who has a medical need that may not be and oftentimes isn't related to their weight at all, but that's all they see. And so all I do is harp on them about their weight when actually obesity is a disease unto itself, and people don't realize that. Even a lot of doctors to this day don't understand that obesity is a metabolic disease. And so it was just such an obvious need in the population that I was dealing with. And so I just sort of fell into it and I've been doing it ever since.